Dr. Mi-Young Ri from the Celiac Disease Program at Children's National Health Systems, and she is the lead psychologist there, and she is going to talk a little bit about celiac disease and psychology. So, thank you.
Hi, thanks to everybody for being here. As Courtney mentioned, I'm going to talk a little bit about celiac disease and some psychological factors related to it. Just very broadly, I think a couple of areas that I find to be sort of the largest areas to think about and discuss are just diagnosis and sort of what that experience is like for a lot of people. Of course, the challenges of adhering to a gluten-free diet. And then just lastly, touching on some tips about when you might consider considering following up for extra support and psychological care. So one of the things I'm sure a lot of you are already aware of, but some of the neurological and psychiatric symptoms that can be associated or present with celiac disease in particular, but sometimes with other gluten-related conditions as well. This is important, because I think a lot of times I've worked with families who've had different experiences with diagnosis, many of whom have had a long road to getting diagnosed, have had a lot of misdiagnosis, and as part of that trajectory have sometimes interfaced with people in mental health. And so I think as mental health providers, but also as families and advocates, it's important to know about, some of these symptoms that people might not necessarily think initially to be connected with celiac disease or another gluten-related condition. And so some of them, and this is definitely not a comprehensive list, but just a few to touch on, difficulties with attention and concentration. Sometimes people describe that as sort of like a brain fog, anxiety, changes in your mood, irritability, fatigue, abdominal pain, changes in your sleeping, your eating, your weight, those kinds of things. Those are sort of broad changes to be looking for, and I think they can signal concerns about either mental health or physical health or sometimes both. So this isn't to say that this is to try to make a diagnosis, but this is just something to think about, that there can be some overlap in terms of the presentation and the symptoms that you're seeing. And like I mentioned before, I think that getting a good sort of sense of people's experience with diagnosis can be really helpful to get an understanding of just what that path has been like. And I think some of the themes that I've seen, especially in working with a lot of the children and teenagers that we see at Children's National, are one, just getting misdiagnosed or getting sort of passed around from one provider to another without getting a lot of information or answers, and so there might be some confusion. And then sometimes there can be a little bit of mistrust of providers and, having some negative experiences there. Not with everybody, but sometimes. And then on the opposite end of the spectrum are some kids who might, and adults as well, but, in working with peds in particular, who might not have any symptoms. And so it's a little bit confusing to them when they get a diagnosis and then the recommendation to completely change their diet. And so trying to work with families on how do you help people understand that if I hadn't felt badly, that I still need to make these changes. And then, in working with kids and families, one of the things I really talk about a lot is just making sure that you're talking about things and presenting information in a developmentally appropriate way for the age that you're working with. Adherence to a gluten-free diet, which I think can be a challenge for everybody. And I think some of the presenters that we've had previously have touched on some of the topics that can come up. One question in particular is, even though there might be one person who has a diagnosis in your family, it really impacts the whole family because food and eating is very social within your family, outside of your family. And so there are just some key decision points, and there's no one right answer, but you have to figure out what's the best fit for your family. Is it everybody going gluten-free, or is it going to be a combination? And how do you pick that choice, but then also make it safe for everybody, whoever has the diagnosis as well as the rest of the family, in terms of physically, but also just, thinking about emotional health as well. And then, a lot of, whether it's the adult or the child that has to be gluten-free, there's a lot of preparing and planning. And I think that in order to be successful and help kids, teenagers, adults to feel empowered on a gluten-free diet, a lot of preparing and planning needs to take place, but that can be really stressful. So as much as you can do to help yourself with that, know that that's a lot to take on. Use the supports around you. And I think coming to something like this and getting information and reaching out to resources is really helpful. And as much as possible, if you're in a household where there are multiple adults, pooling your resources together in terms of, who does the cooking, the shopping, getting information, looking for resources, those kind of things. And very broadly, when you're thinking about preparing and planning, I think the most obvious environments to think about are how you're going to conduct things at home, but then also eating out. And so eating out can be going out to a restaurant as a family. But if you have children or teenagers, you also want to think about where else they're going to be. In school, with other families, going to events with their teams, and other kind of social opportunities. And so making sure that you're also planning ahead for that, educating people about what is safe and not safe, and just really, I think for a lot of kids and teenagers especially, planning ahead can help to minimize, at least, even if it can be difficult, some of the impact of having to have a different kind of diet or food. And like I mentioned, trying to use the folks around you, create supports, educate people. I know that can be sort of a lot to take on, but I think the more the people around you know sort of what it means to be gluten-free, that can be really helpful, and then increase their understanding and their ability to be able to provide supports to yourselves, your families, and your children. And especially if you have anybody who's in school, public schools, they need to be doing plans to accommodate students. And then there are different ways to get services and information for people like in college and as you get older as well. So just important to, if you don't know about, resources, try to find out where you can start to get information and get help for that. Another part that might be helpful in trying to think about keeping to a gluten-free diet is identifying what are some potential barriers to keeping with it. And that could be different for everybody. But one for sure is, making sure you have accurate information about whatever your condition is, and then also, like we're talking about here, accurate information about what are gluten-free foods and products. And there's just so much information out there now, especially online. You just want to make sure that what you're accessing is accurate and up to date. And then, as we've talked about, part of what you want to do to be able to successfully maintain a gluten-free diet is you have to learn some skills. And as adults, you can do these things, but when you're thinking about children, you want to think about how to initially start being the model, but then gradually over time, as they get older, and they're able to help them develop some of these skills as well. The basic things, reading labels, scanning ingredients, and we've already talked about here some of the things that have come up. A lot of people, everybody in this room is bright, educated, invested in having the right information, and it can still be really confusing. So I think just being able to acknowledge that. And as has been brought up a couple of times, questions about cross-contamination. And so knowing how to ask questions about that, get good information about that, and just considering that in general, whether you're cooking at home or if you're at school or out to eat. And then, like I mentioned before, if you're not sure what the answers are, trying to figure out where are the resources that you can go to try to get some more information. And then I think for children and adults alike, thinking about how to handle social situations is really important when you're trying to have a successful gluten-free diet. And so part of that is acknowledging some of the challenges that can come up and then preparing for that the best that you can. And two broad categories within this. One is how to be socially assertive. So, we had talked about, when you're at a restaurant, knowing how to ask questions, how to advocate, and the more you do that, being able to be more comfortable with that. And one of the things that I find is that a lot of times parents will start to set that role model and example, and the more that kids and teenagers see that, then they'll realize that that's something that's okay to do, and then be able to learn how to do that themselves over time. And then, the other part is I think that there are a lot of kids and teenagers especially, but I also think this happens for adults, feeling more isolated from having to have a different kind of diet in social situations. So just trying to figure out how to navigate that, both logistically in terms of being able to have something there that you can eat and have, but then also how to handle different things that might come up in terms of questions from people or comments or those kind of things. And lastly, I just wanted to talk about when it would be good to consider seeking psychological care. Initially, when you have a diagnosis, I think if you notice that there is difficulty either accepting or coping, I think adjustment difficulties, whenever there's a change, is natural and to be expected. But if you find in particular that you're working with somebody who, is really struggling to accept and acknowledge the diagnosis, and then also once they have information about the diagnosis and know that they need to maintain a gluten-free diet for their health, but are really, really consistently having trouble doing that, that might be a time to consider pursuing formal care. And then if you notice any significant changes in school or social-related behaviors, especially for kids and teenagers, difficulties going to school on a regular basis, big changes in their grades, or you notice they're not turning things in anymore or doing work, and then also if they're pulling out from things, their friends, activities, those kinds of things. Those might be clues to you to think about just, getting an assessment, meeting with somebody to say, is this something that, we should be concerned about or continue to get help for? And then lastly, just, basic, when we talk about maintaining emotional and behavioral health for everybody, these are some of the clues that you might look for, that somebody might be struggling or could benefit from meeting with somebody to see if they could have further treatment, or if there's something that's going on beyond sort of what we would expect. Significant changes in sort of your essentials like eating, appetite, energy, activity level, concentration, those kinds of things. If you notice there's a lot of high anxiety, changes in mood, either mood being really low for a long time or just big shifts. More irritability. That one's a tough one, especially with teenagers, because sometimes irritability sort of is developmentally sort of what you expect. But I think that, part of it is thinking about if you notice these things for a long time, or if you notice that they sort of intensify sort of quickly, those are the clues that it might be above and beyond sort of what we would expect. And like I mentioned before, pulling out of things, either activities with friends or they just don't enjoy things or want to do things as much. And of course, if you sense any sort of, hear anything or sense from them, thoughts, feelings of hopelessness, and safety concerns like thoughts of hurting themselves or others, that is a for sure. It would be a great idea to go get checked out and see if there's anything more that could be helpful. Thank you all very much.